getting a good night's sleep could help you lose weight.
Canadian researchers say sleep is an important key to weight loss, along with a healthy diet and exercise. Their studies found both total sleep time and quality of sleep predicted the loss of fat in those enrolled in a weight program.
Lack of sleep appears to increase the hormones that regulate appetite, as well as the impulse to consume more food. That has to be my problem, Matt. Lack of sleep.
Well, joining us right now to talk about the study is Dr. Stephen Krawtz, the special care specialist and pulmonologist from Portneuf Medical Center.
Dr. Krawtz, many of us struggle with maintaining a healthy weight. Could lack of sleep be helping that along so that you're not losing the weight that you want to be losing?
Well, as you mentioned earlier, the population is gaining weight. And as we see an obese person or a person overweight, we're starting to see more sleep problems related to weight gain. The most common being obstructive sleep apnea, which affects about 1 out of 20 adults. And these sleep problems disrupt your sleep, so these patients have poor sleep, and as a result of poor sleep, they're more fatigued and tired during the day. So to lose weight, you have to follow a good diet, you have to exercise, and try to stay active. But if you're fatigued all day long, you tend to...
Maybe if I eat more, I'll feel better, I'll have more energy.
Exactly. You tend to get home from work, sit down and eat, or fall asleep on the couch instead of going for a walk. And you just don't have the energy to exercise, and you typically get frustrated and don't have the stamina to continue with a diet to help you lose weight. And then you gain more weight, the sleep problem becomes worse, and it snowballs into increasing poor sleep and progressive weight gain.
Which should you...
I feel like he's like describing my life
Your
right
life.
now.
A lot of our lives. So when we want to stop this cycle, which should we start with first? Should we start with getting better quality sleep? Should we start with the diet? Should we start with exercising, even though we may not want to? Which one would be best to start with first?
The biggest problem with sleep disorder breathing, where people are overweight or obese and have obstructive sleep apnea, is they're not breathing properly at night. And that happens repeatedly through the night, night after night, week after week. And you can't fix that unless you can lose enough weight to improve those symptoms. So if we can evaluate a person and treat a person who has a problem like obstructive sleep apnea, once we improve that or fix that, then the person's quality of sleep improves, and the dieting, weight loss, and lifestyle changes become easier for that patient so they can lose weight.
So when you say improve those things, are you talking about things like a CPAP at night so that they aren't, stopping breathing, that sort of thing? Or how do they improve that first? Do they just have to push through and exercise and diet no matter what so they can lose more weight and therefore sleep better? Like
With sleep apnea, one of the treatments is a CPAP mask, but sleep apnea comes in different degrees of severity. For a patient with mild sleep apnea, it may be exercise, weight loss, and trying to get enough sleep for a number of months, and if they can do that and improve, then they're doing better. But some people that have moderate or severe sleep apnea need treatment such as CPAP and a more structured weight loss program. There's even more programs such at Portneuf that have bariatric surgery, surgery to help a person lose weight, to try to control all the adverse health effects of being overweight. So CPAP is an option for people that are more severe, but not necessarily for everyone.
So it's kind of like you have to treat them all at once then.
Exactly.
Yeah. So when we're asleep, we can't monitor ourselves. Maybe a spouse or partner could look for some signs, looks for some things like maybe jerking awake or not taking a breath for a little while.
Yes, there's a number of signs or symptoms people can have, and we can ask a whole bunch of questions, but the most accurate is what a spouse or sleep partner will tell you. So let's say this person's a loud snorer. They're gasping at night, they're grunting, they're stopping breathing. That's the most accurate history one can get about a person's sleep. The person can't tell you that much because they're asleep.
They're the ones who are asleep.
They only can say, I don't get enough sleep and I'm fatigued. And they don't know what's going on because they're asleep when the problems are occurring.
Yeah, great. Dr. Stephen Krawtz, thank you so much for joining us. We all need to get better sleep.
Yes, we do.
All around.